Hello, I'm Nurse Maxine. Today I'm here to do an assessment of Baby Jane. Baby Jane was born 30 minutes ago. Her APGAR at 1 minute was 8 and at 5, 10. I have read over the notes and her amniotic fluid was clear. She was a vaginal delivery and there was no complications during the delivery. Okay, she has latched on to her mom's breast already. I've observed her bonding, and so now I am going to go ahead and do a head-to-toe assessment. I'm going to first start with auscultation while she's calm. We're going to go ahead and listen to her lungs in all fields. Oops. I'm hearing a little crackling in her bases, but that is normal for a newborn baby and that should resolve in a couple of hours. Okay, her lung sounds fine except for a little crackles. I'm going to go on to her abdomen and check her bowel sounds in all four. And while I'm doing this, I'm going to check her vascular pulses. I'm going to start with her renal right, renal left, iliac left, iliac right, femoral right, and femoral left. Everything seems normal. I don't hear any friction rub, hums, or brewing in the baby. I am going to go ahead and check her respirations. While I'm still listening, I'm counting for 1 full minute. Respirations 28, and that is normal for a baby. I am going to check her heart rate, the apical pulse, and I'll listen again for 1 full minute. Her heart rate is 130, and again that's normal for a newborn baby. Alright, now that I've completed the auscultation, I'm going to go ahead and do a complete inspection from head to toe. Alright, starting with the head, I'm going to examine her skin, looking for any lesions, any discolorations, any warts. She might have redness on her face, which we call stark bites, and those are normal in a newborn and will resolve over a couple of days. Okay, I'm going to check her anterior fontanelle. It's soft, it's not bulging. We're going to check the posterior fontanelle, soft and not bulging, and this will go away within 2 years of her birth, so it should be soft at this time. We're going to go ahead and measure her head circumference to just get a baseline of her. She's measuring 12 right now, and we'll document that.
Do that again.
We're going to measure her head. Measurement is 12. We'll go ahead and document, and we will follow up with subsequent documentation when she comes for her later visits. All right, let's go ahead and measure her. I'm going to mark from the crown of her head here to her toes. And I'm doing things just simultaneously while the baby is still calm. Okay, baby's measuring 10 centimeters. And I weighed her before we started this, and her weight was 6 pounds and 3 ounces. All right, and continuing with the inspection, we're going to look. I'm going to check her pupils bilaterally. They're both equal and reactive to light, and they constrict. Let's check her air. Her tympanic membrane is nice and clear. It's not pink, and there's nothing draining there. Okay, I'm going to look into her mouth. I'm going to check for any discoloration, thrush. And while I'm there, I am going to go ahead and use a gloved finger to check her reflex here, which is her suck. I place my finger there, and the baby latches on, which is great. Let's just go ahead and do her routine right lip, and she moves to my finger, routine to left, and she moves there. So that's a part of her neurological check. Okay, we're going to go down and check her entire body, looking for lesions, raised areas, palpating lightly for any masses as we go down. And also, as I'm doing this, I'm checking her pulses too. Temporal, bilaterally, carotids, one at a time, We're going to check her brachial, both. Everything seems equal right here. Radial, both sides. We check the femoral, popliteal, and everything is done bilaterally. And we'll just check her dorsalis pedis pulse. Okay, everything seems fine there. Let's just finish up with the neurological part of her reflexes. I'm gonna go ahead and check her sorry, her palmar. I place my finger in the palm of her hand. She grabs on both sides, everything, both sides. She grabs. Let's check her Babinski. Stroke my finger lightly, the sole of her foot, and her toes flare upwards. And this is normal in the newborn, but should resolve in the first couple of years of life. Okay, we're gonna check her vaginal area. There's no bleeding, there's no discharge, there's no redness. Looks good. Let's go ahead and turn the baby over and check. We're gonna check her meninges. We're gonna check her spine to see that it's straight, it's in line, and there's no hair or any sacs. And we're gonna check the buttocks. The buttock is a little blue, but that is normal in a newborn baby, and that too will resolve over a couple of weeks. Looks good there. Let's turn her back. And we're just gonna make sure to check to see if there's any displacement during her birth. We'll check her clavicle and checking for click. And also baby will cry if she has any displacement there, because that will hurt. That's good there. We're gonna check her hips as well. I'm gonna rotate her hips outward, and that's good. She's not crying. Seems like everything's good there. Okay, I initially checked her temperature rectally, and it was 97.7. So from head to toe, I would say baby Jane looks good right now. She's doing fine. Thank you.